of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you.
Hello, Bob.
Okay, when I hang up, you'll have it. One
Okay,
moment.
thanks. All right, Bob, are you there?
Yeah, I am.
Okay.
Welcome, Commissioner Bush. Commissioner Hurst is here, so we have all of our commissioners here, you by telephone. I do not have any opening remarks today. With the agreement of Commissioners Bush and Hurst, I'd like to move things around a little bit this morning. We do have some people in the audience that would like to make a public comment or discussion, so I'd like to go right into that, and then right after that, I believe we have an update from Gary Mager and John Deardoff on the project that they're working for. So I'd like to put those two items in front of the Health Department report, then we'll move on to the regular agenda. Is that okay with you, Commissioner Hurst?
Yes.
Commissioner Bush?
That's fine with me.
Okay. Okay, this time we'll have public comment by items not on the agenda. If there's anybody in the room that would like to make a comment this morning to the commission, please come forward, state your name and address. Limit your remarks to no more than 5 minutes. Are you all together?
Somewhat, yes.
Somewhat? Please, somebody's got to start the conversation.
My name is Randy Hendrickson. I serve as the superintendent for USD 311 Pretty Prairie. My address is 308 East Pretty Prairie Road, Pretty Prairie, Kansas. We're here trying to seek guidance and information regarding the conflicting information that we get as it is determined by the governor's executive order and then Attorney General's response to that. We're looking here at the local level, and we're trying to make a strong plan to reopen schools, and one of the options that we've heard is that we would be able to have local control within our district at the board level, and so that's what we bring to you to try to do some fact finding to see, is that the case? If so, what would be our protocol for moving forward? And as time is getting short, you know, we've had kids on a 6-month spring break. We're ready to get them back. Their folks are ready to get them back, and believe it or not, they're ready to be back. So can we have some guidance?
Okay, Randy, thank you very much. Is our County Councilor Joe O'Sullivan or Commissioner Hurst, I think both of you know a little bit more than I do about this this item. Would one of you like to address this issue?
Yeah, Joe O'Sullivan, a county councilor. Mr. Hendrickson is certainly correct. There is a lot of disagreement at the state level concerning the authority of the governor's order, the authority that local districts have, and the authority that the county government might have under House Bill 2016 to override the governor's order. As it's her order, what we're talking about is 2059, which the order she issued, I think, just late last week with respect to school districts. And I talked to the district attorney about this the middle of last week, and of course this thing is in flux the whole time. That was before the Attorney General issued his opinion that as I understand it, I haven't read it, that the county government does have authority under House Bill 2016 to issue a less restrictive order than the governor's. However, there are conflicting legal opinions from the State Department of Education and an association of the district attorneys. What is that association?
Kansas Association of School Boards, KASB.
Kansas Association of School Boards, as to what that authority is. And of course, we're in no better position than the superintendents are to know in the end what absolute authority there is. But that may only be determined if somebody files a declaratory judgment case in district court asking the court to interpret and apply this, because when the judiciary does that, it brings finality to such things. But I think the important situation here is also to consider that any order issued by Reno County to be enforceable it would be the district attorney that would enforce that, not the county councilor, but the district attorney. And I did talk to Tom Stanton, and we were of the opinion last week that the county government, based upon what we knew at that time, that the county government does have the authority to issue a less restrictive order than the governor's order 2059. That was our preliminary indication. I would suggest that one of the things we were interested in knowing is, last week, Tom and I, that it would be good if we knew what the individual school districts were planning with respect to less restrictive measures. Because to the extent that we went there, we'd want to coordinate our activities with individual school districts potentially, rather than one order fits all. We've got school districts of various size and maybe of different concerns. And so it wouldn't have to necessarily be one order. It could be an order, if we're going to do that, pertaining to 308, or another one pertaining to 311, or whatever it might be. So we were interested in gathering some information from the various school districts as to what their plans might be in this regard, what thought they've given to it, so that perhaps in coordination with the health officer, if there was a consensus, we could put together such an order. That was a preliminary thought we have. We don't have that information at this time, but I think that'd be something that we ought to pursue. In the meantime, I'll get together with Tom Stanton and discuss the Attorney General's opinion, and the other legal opinions are out there, and perhaps advise you as to, at the local level, what we think we can do with maybe greater certainty than I'm able to provide you right now.
I know this has come about just real quick, like yesterday. Commissioner Bush, this is ever changing, as you know, and Commissioner Sellers. And one of the thoughts was that the school districts are all working with Nick, the county health director at the present time anyway, and that the possibility might be, now I'm just saying possibility because it's all so much in flux with 4 different ideas coming out of the Capitol, that they develop a plan for school opening, that they present it to the county health director for his agreement or changes. And then if that's the case that Mr. O'Sullivan gave earlier, that then they could present that to the commission, and upon his directive, that we could then decide whether to approve or disapprove the plan. Now, I know that's getting, every day is getting closer to what you want to do, and that's get the kids back in school. And I know that the CDC recommends reopening schools, and so that's one option, and that came about just realistically a little bit yesterday, but a little more confirming today, that could be a possibility. But I think before Joe, before the end of the week, maybe we'll know a little more. Maybe we'll have a 5th one come in. Who knows? But I think, Al, I've spoken my thoughts on that. I think Joe's covered it really well. Some of you others, go ahead and speak up. Other people here from school districts.
Good morning, Commissioners. I'm Derek Zonker, 2104 South Langdon Road, Plevna, Kansas. I currently serve as the Board President of USD 310. And first off, I want to say thank you for your leadership on this. From the very beginning of this pandemic, we've been handed down what you will do, and we'd very much like to do what we can do and what we know will fit better with our district. As you know, all the USDs in our county, none two are the same. A cookie cutter mandate will not suffice for us as a local board to come together and make the best decisions that we can for our faculty, staff, and our kids. We'd appreciate your consideration in this change that we can do at the local level, and and do the right things that we know we need to do for our own kids. We appreciate that.
Mhm.
Thank you.
Okay, thank you, Derek. Joe, is the best information you have at this point in time that each of these districts should be presenting their individual plan to our health director for his comments? And as far as I'm concerned, if the health department agrees with the individual plan of these districts, if we do have to approve it, I certainly believe that every district could have a different plan, and that would be in their best interest to have a different plan. So instead of saying wait for a week, is that what our advice should be at this point?
Well, yeah, Mr. Stanton's request and mine was to find out what the plans look like. We've never seen one. I don't know whether it's 110 pages or what we're talking about, but we're talking about addressing the governor's restrictions, not the entire plan. It has nothing to do with whether the school's open or not. That's entirely within their authority to decide that. So I think while we try to figure out what the law requires, we'd like to find out what those plans contain so we could proceed.
So I see some people shaking their heads, nodding to that statement. Can the districts put together their plan as it relates to safety and for the students, faculty, and administrators, and get that to the health department ASAP?
Yes, sir. And to clarify,
Please, Randy.
Come on up, Ms. McKinney. Yes, we're glad to do that. Nick Baldetti has been very involved throughout the summer, even as we've accepted different mandates, different orders of what we're to do. And so our plans have been flexible, and we've been working on those. We're more than glad, and I know Mrs. McKinney could speak to that. We've been working together as Reno County Superintendents with Nick to develop our plans. Currently, we've changed our plan a little bit, and as things change as well. But right now, I think we have 3 options for USD 311 that we could present to Nick for his ratification.
Wouldn't you present the option that your board feels is the best interest of your district?
Yes, sir, we would.
I would suggest that you ought to present what you feel is the best instead of options.
Okay, can do.
Betsy McKinney, Fairfield USD 310 Superintendent, and I live at 34308 West Arlington Road, Sylvia, Kansas. As Randy spoke to you, we have been working on our plans for a good part of the summer because we've been anticipating this coming. It's been a wavering journey because as something comes from Topeka, you have to sort of change your plan and go with that. I have been sharing details of my plan with the board. And I say my plan, but it's really our plan because this began with 20 different people, teachers, parents, community members, a board member, myself, administration. We all met together, and 6 feet apart, but we all met together, and we worked on, how can this look at Fairfield? And so our plan resembles the governor's plan pretty closely with maybe 1 or 2 exceptions. So we're ready. I mean, I could submit that for approval this afternoon, but that whole process has involved meeting with Nick over the summer, and he has given us some guidance along the way. So this isn't something we just sat down at our desks and wrote, just so that you understand
Sure.
the work that's gone into it.
Sure, appreciate that, Betsy. I think at this point, we're in agreement with your concerns, and due to the time constraint of wanting to get school open when your boards so decide, please get this information to our health department ASAP. I'm sure that Nick will turn that around immediately. And if Joe finds in the meantime the commission has to approve those plans, we'll do that as expeditiously as possible. We meet every week, so we understand your problems. From my standpoint, I don't think all these plans have to be the same. I think you need to, as you've done, look at your students and the area that you cover and come up with the plan that fits them. saw last night on the news that some people are gonna, meet a little earlier, some people a little later. I don't personally think that that makes a lot of difference to, our health and safety. I think it's more important that you have a plan to try to keep your students safe, so.
I would agree with Commissioner Sellers.
Thank
on
you
this.
for being here, and please let any of us know if during this process you need our individual help, and we'll see if we can't expedite this process.
Thank you.
Thank you
That's-
for being here.
Hope that was some assistance to you with regard to this.
Okay, well,
We get frustrated, Commissioner Sellers. I know you and I and Bob have both been frustrated sometimes with what comes down to regarding our jurisdiction over our citizenry
Right.
too.
correct. Thank you. Okay, I believe we might have another gentleman in the audience that wants to make a public comment, and while we're on.
Item is on the agenda.
Okay, thank you. Is there anybody else in the audience that wants to make a comment at this point? If not, is Nick and Adam?
They're outside.
Okay, if we can get Nick and Adam in here, we'll have a health department update.
Just want to say hello to Bob.
Hey, how we doing?
All right.
I wish I was there in the room with you.
Bob, I was trying to do this via phone last week, and it's certainly kind of a blank spot, so just bear with us as we get people in and out the door.
I seem to have a good connection, but I think that'll be okay.
Good.
There's people, the other people on here are watching, and there's probably about a 30-second delay. So.
Oh, really?
Okay.
Okay. Okay. At this point in time, we'll move to item 4 on the agenda, which is a COVID-19 update from the Health Department Director, Nick Baldetti, and Emergency Management Director, Adam Weishauer. Gentlemen,
Morning, Commissioners.
and Nick, Commissioner Bush is on the phone with us, so
Okay.
you're speaking to 3 of us.
All right.
Hey, Nick.
Hey, good morning. Nick Baldetti, Reno County Health Department Director, appointed Health Officer, Reno County. Just jump right into it. As of this morning, the United States, we're at 4,295,429 confirmed cases of COVID-19 with 148,066 mortalities associated with COVID-19. Apologize, let me silence my phone. For the state of Kansas, as of yesterday at 2 p.m., the state of Kansas is at 26,172 cases. 1,644 of those have required hospitalization, and we've registered 335 fatalities associated with COVID-19 in the state of Kansas. For Reno County specifically, we've tested 4,167 constituents with 3,962 negatives. In aggregate, since this event began in March, we've registered 205 positives. We currently have 41 active cases with 2 active clusters. One is in an aging care facility, and the other is the state correctional facility. We have registered 1 fatality as of last week that is COVID-19 confirmed. Our aggregate positive testing rate since this has begun has risen to 4.92%, and we've tested 6.63% of the population. And we have 163 of that 205 that have fully recovered. As of this morning, our hospital activity, the hospital has a total census of 67. They have 3 that they have tested and are waiting for those results, and they have 2 positive COVID-19 patients that are admitted. They don't have anybody intubated as of this morning, per Mr. Welch from the hospital. Our prior week positive testing rate fell a few points from yesterday, from I believe it was 7.2% to 6.89% as of this morning. Our 7-day average positive testing rate from July 22nd, so caveat is that 6 days old. 7-day average positive testing rate is 9.2% as of the 22nd. Additionally, added to the daily sit reps, there's a new tool that is championed by the Georgia Tech University, and basically on a per county basis aggregates epidemiological data and spread to put together percentages for certain number of people in a gathering. So the thresholds I'm reporting on our daily sit rep now are gatherings for 25 or less, 50 or less, or 100 or less. Per the tool as of this morning, a gathering of 100 people or less, there's a 69% chance that someone who is COVID-19 positive may be in attendance. For a gathering of 50 or less, there's a 47% chance that someone who is COVID-19 positive will be in attendance. And for 25 individuals or less, there's a 26% chance that someone will attend who is COVID-19 positive.
Nick, is that both indoor and outdoor?
It does not. Yeah, it does not differentiate. Yeah, and
Okay.
nor, to my understanding, although I'll be honest, I haven't read the entirety of the fine print, does it account for mitigative interventions like mask use or social distancing aspects. I'm sure that there's some aspect of control within the actual data itself, just because it is aggregate epidemiological data over spread. So almost everywhere in the country has some aspect of mitigation installed right now in their community. So it's kind of, if you will, baked into the data, but it doesn't specifically narrate that out in the kind of fine print. From a COVID-19 activity report, I think that's all I have for you, unless you have any questions.
Is the fact that our positive testing is going down from a higher point a positive indicator for the county?
So I would think it's a little too early to, yes, it is a positive indicator. I think it's a little too early to say that we've had any kind of meaningful impact due to the lag on laboratory results. It roughly takes about 10 days right now for a laboratory test result to come back. And then you add into the addition of the most conservative estimate is a 2-week window for symptom onset of an individual who is infected. And you're looking about a 3.5 week out date. So hopefully in 2 weeks from now, we'll be able to kind of look at the prior week PTR trend and see if we've really kind of made a dent into our increasing spread. I would say optimistically, we had a PTR, we capped out for the the positive testing rate for the week of July 5th through the 11th. We had over an 11% positive testing rate. The next week we fell to about 8%. Or actually, I'm sorry, we fell below 8%. And then as of today, last week's isn't finalized because we're still waiting for test results to come through, as well as obviously for 2 weeks ago and then this week. So there's certainly a lag, but if the data continues, I would say that we've plateaued, which means that we're having some effect in slowing in our community. So.
Good. Commissioner Bush, do you have any questions?
Yes, I do. So, Nick, when we plateau, for 2 weeks, do you think we can look at eliminating the mask policy? Or do you think that's what it means? You're going to recommend that we hold on to it?
Commissioner, I think it's going to be important, especially moving into the fall with school. that we want to continue to try and stymie the spread as much as possible to ensure we can try and have kids in schools for as long as possible. I'll repeat what I stated at the 308 board meeting last night. It is within my expectation, meaning that there's nothing from either national, state, or regional trending, and everything I currently understand from the scientific literature to suggest that we're going to have a full fall of kids in school. I would expect that at some point kids are going to go full distance learning, and so I think it's going to be important that we get kids in as quickly as possible to establish those relationships with those educators before that happens. And I think one aspect to try and keep kids in school as long as possible is community-wide mask use.
Okay, appreciate that. Also, if you were out of the room when the school district people were talking, is that correct? You and Adam were out of the room?
We were listening out in the foyer.
Okay. I'd be curious to your thoughts about having to review every school district's plan and approve it, and then comparing that with your current level of resources and how things are going with your staff. Can you talk about that a little bit, please?
Sure. I think it just depends on the complexity of the plans that are presented. For example, 308 has a generally expansive plan. However, Hutchinson School District 308, for which more or less health aspects were hyphenated and presented, and so I would say the act of reviewing that plan, or at least the aspects that was asked for the review, for my time as health officer took maybe 3-4 hours. I think the same could be said for Buhler school districts. So I think the feasibility of plans, if they're presented in that manner, it's feasible. Without counsel in the room, and I'm sure this will continue to be conversations, I have concerns over the aspect of the authority of county over the aspect of school plans as it relates to elected school boards, and I'm not quite sure of that. And I know I began to have conversations with Joe with regard to authority of the health officer to mitigate pandemic threats, which most certainly we are in. There's just some, not being a lawyer myself, there's just some gray areas that I think I just need better advice from Joe or Tom. But I think it just depends on, as long as I'm not looking at a 500-page reopening plan, I don't think it's unattainable. It just siloing off some of that time to review those plans, I suppose.
Well, it just sounds to me like you're going to get a number of school districts putting a bunch of plans on your desk, and they're going to be looking at you to turn it around, as the chair said, pretty quickly. And I'm just concerned that you have the resources to do a good job with that.
I think reviewing the plan, I'm not as concerned with. Again, I think I'm concerned with, and this would be a question for council. I guess I'm concerned without Joe weighing in on a rubber stamp from me that kind of moves a board and an administration forward, thinking that they're A-okay. And I suppose if there was confirmation from Joe of that. I just think it's such, if I can be candid, I think it's such a mess at the state level right now that I just don't want to open the county up for any kind of liability, whether it's my signature or the Board of Health's signature or what have you, because I just don't know the kind of grace that's going to be levied at the state level. I hope that makes sense. I don't know if I'm articulating myself as clearly as I hope.
Well, I'm not sure what you're going to get. I don't know if you're going to get a 5-pager or if you're going to get a 500-page document to look at. I do think it's important to focus strictly on the health aspect, not the educational when you start up the investment. At least that's my take on it. That right,
You broke up a little bit, Bob, but I don't know if it's what you were specifically referenced in your comment, but for example, Betsy, who's the superintendent of, well, one of our rural schools, Fairfield, is that right? Or
Fairfield and it's Pretty Prairie.
Pretty Prairie, okay. 311, I think, or 310. Anyway, just grabbed me as I was walking in and said that she was going to email me her plan this afternoon. So, I mean, I'll have one. I guess I'll have a test, if you will, in my mailbox this afternoon. But again, if I lean into what was provided to me from 308 and 313 Bueller, I don't think it's unattainable. It's just, you know, I can certainly look at it and put any kind of comments in terms of the recommendations that they are going to provide to their boards from a health perspective.
Nick, did you have recommendations after reading Hutchison's and Bueller's plan? Did you have some recommendations to them to change their plans?
The only recommendations that I had for 308 and it was generally worked into Bueller's is, given all the uncertainty around the governor's 20-59, I simply narrated that I think there's so much uncertainty around the legalities of a school board or the Board of Health, quite frankly, being able to amend, change, what have you, the mitigative measures set forth in 20-59, that I just thought it was really important that the board itself discuss that and really agree on moving forward if they divert from 20-59, because I don't think we're going to get a clear answer on liability until it's mitigated at the Supreme Court.
Okay. Any other questions of commissioners?
I have none.
If not,
no.
If not,
Great.
let's go on to our emergency manager director's report. Adam Weishauer.
Morning, Commissioners. Adam Weiser, Emergency Management Director. This is day 150 of our response. We started all the way back on March 1st. March 19th, the Board of Commission declared a public health emergency, and that is continued until December 31st of 2020. There's 104 counties that have declared a disaster. Chautauqua County is the only one who has not. There's 103 counties with active cases. Wallace and Rawlins County are the only counties in Kansas that do not have COVID-19 in their communities, or positive cases. Those are both in the northwestern portions of Kansas. If you've been paying attention to logistics or the statewide push for meals, the National Guard has delivered just over 4 million meals. It's about 4.4 meals of their 5 million meal project. So they're trying to get 5 million meals to food banks within Kansas. So they're actively working towards that. KDHE is tracking 131 outbreaks. That's down 15 from when we talked last week. Other than that, things are about normal for us, and normal, I mean, they continue to stay busy. We still have conference calls. We're still providing burn rates and receiving personal protective equipment. I will say publicly that looking for the 3-ply masks, the disposable ones that everyone wears, those are pretty easily accessible right now. What's challenging to get at the time being is nitrile gloves, and gowns are becoming challenging again, and then as well as the N95 masks. So we're looking for vendors for all three of those, and we have not found those yet, but we're actively looking for that this week. From a staff standpoint, county staff seems to still continue to pull together. It's been a long journey, and we're being told we were told last month to prepare for the next 12 to 18 months. We're being told this month to prepare for the next 18 months. So I think it's going to be a long journey for us, and I think it's going to continue for quite some time. With that, I'll stand for any questions.
Nick, I had one question.
It's Adam.
Oh, Adam.
They're here together all the time. So
I know, they're just joined at the hip, kind of, huh? Yeah, I bet they're working together hard. I know they are.
Yeah.
What happens if, I think the state has come out and said that the schools will have to get their own PPE, is that correct?
That's correct.
What happens if a school cannot find a vendor to supply that equipment to them on a timely basis?
So
Just curious.
Generally speaking, even in a normal disaster situation, for any agency or anyone in the county to reach out to the state for assistance, they have to exhaust their local vendors, they have to exhaust their local supply chain, they have to reach out to the county has to exhaust their local supply, and then we can reach out to the state. There's really no difference. They changed it so now that the schools have to prove that they've gone out and they've tried to procure that on their own before they can reach out to the state. So if they absolutely cannot get those in a timely manner, they can still contact us and we will send that request to the state. The state, I believe, will fill a portion of that, but they won't give them 100% of what they're asking for.
All right, thank you. That was a question that I had been asked via email, so thank you.
You're welcome.
Commissioner Bush, you have anything for Adam?
No, I don't today. Thanks, Adam.
Okay.
Thank you, Commissioner.
Thank you very much for being here. Okay, at this point in time, I think we'll move on to, we have two of our consultants out in the lobby, correct?
Yes.
If you'd ask John Deerdoff and Gary Mager to come in, we'll hear their report. They've been working on a project where the state has allocated Reno County, I believe, $12.2 million for
12.6 million.
12.6 for public entities to be reimbursed for expenses that they've had with COVID that have not received funding at this point. So, John, would you and Gary make your report of where you're at? I think there's some time situations that August 15th is a drop dead date, I believe, for this to be in. So.
That's correct. Good morning, Commissioners. Nice to be back and get to work with you again. I don't know what's been reported to you. I know Randy's been keeping you up to speed, but you're exactly correct. The county has to submit all the documentation on this, you might say, first round of submittals by August 15th. So we've been working with the public agencies and several other groups to try to get information, reports to us by this Friday so we can get a better idea how much is being requested. Then after that, we'd like to ask that if you're available, that we have a work session, perhaps talk about some of this between maybe that week of I believe it's August 3rd, and then discuss this in an open session, in a work session, and maybe have a better idea by the end of that week. So then the county can put together the final report or submission and get that into, because your meeting on August 10th is probably where you're going to talk about this and give the final okay to submit that to the state. But when we first got into this, we thought that probably the, with $12.6 million. There could be some money left over after having several meetings with with the school districts and the cities. We've met with all of them. We've talked with all of them. We think that there could be some money. Right now, we don't know how much money that will be in excess, or that how much will be left of the 12.6. We don't think that their requests will consume all that, and so we've been contacted by private schools to find out would there be money available by the healthcare agencies that have had costs that they would like to perhaps receive some funding if possible. And then we have this kind of a other category that under the CARES Act, we can give, the county can give aid directly, or they can create a what they call a program. And so we've been talking about the possibility that if it's acceptable to you to maybe look at a program that would consist of maybe 4 sections. One to help small businesses maybe less than 50 employees, nonprofits, tourism, and childcare. And so the amount of money that would be available to those would be based on, after we receive everything that's come in, looking at the whole thing and obviously talking with you, then maybe we could sit down and determine how much would be available for this last category, and then split it up from that point on. But that's kind of where we're at right now. We've like I say, been in contact, and we've received contact from a lot of different organizations looking at how we can best utilize the money and provide economic reimbursement for the people, the organizations that have had costs associated with this, and best utilize the available funds.
Okay, thank you, Gary. I've listened to 2 Zoom meetings, one in-person meeting and 1 Zoom meeting that this group that they're putting together has been in. One was yesterday. Personally, I think you're on the right track, and I think you're doing what we've asked you to do, is to gather the data from the individual school, city, and county reports, and I believe that that's going to be in yet this Friday.
Mm-hmm.
So would it be wise to meet with us Monday or so to, or do you want to do it at a council meeting to see where we're headed on this? Because we really have only got, as of next week, about 12 days to get the final report
I think
done.
you'd want a work session either at the end of this week or early next week, separate from your normal
Okay, well,
business
my
meeting.
concern this week, I don't think you'll have the numbers in until Friday, and what I heard was that Leslie was gonna work hard this weekend to maybe compile numbers to know where we're at. I don't know, Commissioner Hurst, are you available Monday if we
As far as I know.
something together? I think I'd rather do this in maybe a study session or something of that nature. Gary, explain to me, today you came, I was aware of the potential for some business grants and some potential for some aid to nonprofits, but the last 2 I have not heard about. What's your thoughts about tourism? Where are you coming from there?
Well, there's been some requests, from, I know that we've had some meetings, and there's been a request that childcare is one of those areas where one of the issues that people have is if they don't have childcare, it's going to be harder for them to go back to work. So there is some thought that perhaps childcare needs to be some money available for those particular organizations. Then the other one was tourism, which would take in things like the Cosmosphere, the museum, those kind of things. State Fair could be in there. So.
Okay, I better understand what you meant by that category of tourism. I think before this is over, we're gonna have a lot of people wanting more money than we're gonna have available. So
I think there's no question,
that's-
once we open this up, and I will say that originally when this came out and we were listening to the information coming out from the Sparks Committee and the Office of Recovery, it was all really directed towards the public agencies. Then probably about a little over a week ago, maybe 2 weeks ago, they really started opening it up for some other things and said you can fund those other agencies under certain circumstances. You know, the information that they provide, we could look at that and reimburse them for costs or costs that they will incur.
So would this maybe be better for like Monday afternoon, so that the two of you Monday morning can digest what Leslie has?
I think that would be great. Now, I know John will be out of town, but I'll be here, and certainly Randy and I can meet with Leslie on Monday morning, and we can go ahead and try to be ready
Okay.
to.
So, Randy, why don't you try to put together a meeting with the commission for Monday afternoon?
Okay.
Okay, are there any other questions that the two of you, as our consultants on this project, have of us at this point?
I don't think so. We appreciate your input, and we just want to make sure we are moving in the right direction. So we can, once we have some of this other information and Leslie's able to put that together, I think we will have some information that we can discuss and get clarification on how we want to proceed as a.
Okay, and you're not promising anybody anything, correct?
No,
Okay.
everybody knows it's based
Okay.
on availability and.
Okay, thank you very much.
One quick
Yes,
comment.
John.
Yeah.
John Deerdoff, and one of the things that we're really kind of struggling with is how we would manage that next round, or the small business categories that Gary talked to, and we really kind of focused in on the Reno County
Recovery task
Force is really kind of the county's cover, maybe to kind of manage that, helping, really kind of spearhead that along, because there is responsibility that the county has in delegating these funds, and so that may be a tool when we submit our direct aid as a program under one lump sum. Say it's just $4 million, and then we have the categories that Gary mentioned under that funded, and then there's a group that would oversee how those funds are allocated on your behalf. So
Yeah, I would agree that
Yeah.
county needs a funding device for each of these categories.
Yes, yeah. And just wanted to say hello to Commissioner Bob Bush. Good to hear your voice.
Thanks a lot.
Okay.
Heard, actually.
And we hope things don't change too much in their rules and regulations.
Oh.
I see there's some already changed.
Yeah. Okay, thank you very much for representing the county on this. It's certainly some monies that can help the city, the county, the school districts, and then maybe some other entities within the county. And we don't have a lot of time to make those decisions. So let's plan on a meeting Monday afternoon with whoever can be there.
Thank you.
Okay, at this time, are there any additions or revisions to the agenda? Commissioner Hurst?
I have none.
Okay, Commissioner Bush?
No, sir.
I didn't hear him.
He said no, sir.
Okay. Randy, do you have any additions to the agenda?
No.
Okay, so we'll just proceed with the agenda as stated. Our consent agenda is a little more complex this week than usual. It includes vouchers in the amount of $1,338,872.24. A group of community corrections reports for the fiscal year 2020. Some budget adjustments by community corrections. 2 purchases, solid waste purchase of a 2020 CAT 950 loader at a cost of $229,893.44. Solid waste purchase of a used 2016 CAT vibrator compactor at a cost of $162,000 after trade. And then certain miscellaneous property that's being suggested that we consider as surplus such that we can be sold at auction. First, I guess I'd like to have a motion and a second, and then we'll see if there's any discussion on any of these items.
I would move to approve the consent agenda as furnished by staff.
Is there a second?
Second.
Okay, we have a motion and a second. Are any of these discussions, or any of these items want to be discussed by the commission? Commissioner Hurst?
No, but I would say, just specifically, I don't know whether Mr. Regier wants to comment on him or not, but I certainly think that your department has been extremely challenged by what's been happening, and it was quite evident in your reports that you had a lot of adjustments to be made, and I just wish we had a way somehow to be able to inform all the public as to the intricacies of all your programs that are designed to help people get back into being a productive, efficient citizen, and it's just that.
Sure. Randy Regier, Director of Community Corrections. I don't have anything to add. If you have any questions, I can certainly address those, but I do appreciate your comments that this has been a challenging time, and we have a vulnerable population that we're trying to serve, and it is difficult to assist them when you have some of these other issues. But we've been open and seeing clients for several months. We actually never did lock our doors. So we're going to continue to progress ahead and continue to try to work with what we've got. But if you have any questions, I can certainly try to answer those. But we're going to thank you for that.
Randy, as I'm sure the other commissioners did, read your reports. I guess I've got a couple questions as far as when I was reading the reports. There was a suggestion in several of these year-end reports that you didn't quite make the goals that you had for the year, and a couple of times it was said due to employee turnover. Do you have a problem with employee turnover in your area that the commission can better help with, or was that a unique thing for this year, or is it an ongoing thing?
So we have one retirement that's happening tomorrow, and we had one that happened this past year. So those retirements are, just kind of a natural thing. We had one of the other staff that left that was their significant other got a promotion to Kansas City. So a lot of it is just unique things that kind of pop up throughout a year. But I don't think it's a cultural issue. I don't think it's a problem within the agency. I think that it's just some of those natural things that have kind of popped up over the year. And I think just some of the generational things that we may kind of continue to see some of those changes where younger people are going to be more apt to move and relocate. So we hope we don't deal with that.
Have you been able to fill those positions?
Yes, sir. I think we've got some good candidates, and we've got some good people in there. One of the challenges we ran into is we had trying to plan for some of those retirements and people leaving. We hired a couple people that started at the end of March, scheduled to go into training in April and complete their required training through the Department of Corrections. Well, those are all canceled. So now they're just now getting rescheduled. So that just another one of the challenges that we're dealing with is trying to get people trained.
Okay. Secondly, I read the carryover budgets, 2 of them, I believe, but I didn't really understand what those were saying. Could you not in detail, but tell me what these carryover budgets mean?
So what carryover is this is non-grant money. This is money that we receive from client fees. So our clients pay a supervision fee, both on the adult and juvenile side. The Department of Corrections, even though that's the county's money to spend on those services, they still ask that we do a budget for those. So we have to provide them a budget as to kind of how we think we might spend that money over the next year. Ideally, we don't spend a lot of that money because what we want to do is, this is kind of that rainy day fund. So for us right now, we're looking, the state could cut our grant budgets based on COVID-19. If that happens, my preference is not to come to you and ask for money. My preference is that we use these client reimbursements as that's our rainy day and our backup money to support our programs through any type of budget cut or anything like that. So if we look, just briefly to kind of give you a few numbers on that. So we started on the adult side, because this is our larger one. We started FY20 with just over $108,000. We collected a little over $33,000 this past year, and we spent $38,000. The majority of that went to salary and benefits. A little over $21,000 we spent on salary and benefits, and we spent a little over $14,000 on drug testing supplies. So that's where we end up with an ending balance of $103,000, a little over $103,000. So just trying to try to explain that, we're collecting some money throughout the year, but we're also ended up having to spend some of that money to just kind of to support our program. So that's why I say we want to maintain a decent balance in there, because again, one of the figures we're hearing is potentially a 10% cut. Well, if we look at a 10% cut for us, that's easily a staff member. That's well over a staff member, quite honestly. So we really want to make sure that, if at all possible, we're maintaining that money in there so we don't have to do a layoff. In the juvenile fund, it's a lot more steady. We spend very little out of that. We collect very little out of that. So we've just kind of been able to maintain that. We don't really ask very much for client reimbursements from a juveniles.
Okay. I guess my final question would be as, everybody was upset, everybody's industry was upset in March and April and May and kind of in June and July, and we're kind of getting back at it. Do you feel like you're being able to get geared up much better than you had been?
Certainly. Most of the work that was done in April was done from officers working from home. They were in the office part of the week, but then they were also working from home. And then as soon as May hit, we were back and seeing clients in the office. So our staff is back full time. Our clients are all reporting in. The courts are kind of slow to gear up, obviously, but we're certainly seeing some good progress there. We're still dealing with, treatment providers are doing a lot through telemed, so it's not ideal for us, but we also understand the concern that they have with our population, so it's a challenge.
Correct. Okay, that's the questions I have. Commissioner Hurst, do you have any questions of Mr. Regier?
No, I don't really.
Okay.
I thought it was a good report.
Commissioner Bush?
No, I don't have any questions. As always, Dan's doing a fantastic job with the team.
Okay, thank you. Is there any other questions or comments concerning the consent agenda? If not, would the clerk please call the roll?
Me? Yes.
Commissioner Bush?
Yes.
Commissioner Saul?
Yes. Thank you.
Thank you, Commissioners.
Thank you, Randy, for being here. Okay, item 8, discussion and action items. The first is a proposal from the Health Department for some marketing plans. That we have 2 proposals here to consider. Randy, are you presenting this?
Well, Nick's out on the phone. I can briefly discuss it. I can bring it up, mention it. Let me The health director, Nick Baldetti, in late June during one of the budget sessions, it had been mentioned by the commission for Nick to look into communication companies to do a marketing for COVID-19 related expenses. So a couple weeks ago, Nick had still been trying to get some bids from local companies, and 2 companies
got back with him, Bowercom and Queen Bee, and both of those quotes or proposals are in the agenda packet. The intent, I believe, with doing this is to, instead of staff time, it's having an outside company work with the health department, but then to get a strategy on social media, posters, radio ads, of informing the public about mask usage, washing your hands, all COVID-related incidents that are issues that the health department feels are important for the community. This would go through December of this year and be paid for with the CARES Act money. And I think Nick is back in the room if you have any questions for him about the specifics. Again, it is somewhat high cost, but it would be covered by the CARES Act money.
Morning, Commissioners. Nick Baldetti, Reno County Health Department Director. Per a few weeks ago, at your recommendation, I did reach out to a few local firms. Again, thanks, Randy, for setting the stage. The two bids you have in front of you is for Queen Bee Marketing, and then Bowercom is your other bid. I don't know how in detail you've been able to look through the bids, but essentially I would say generally the difference, as I kind of perceive the conversations I've had with both companies and the bids in front of you, is that the Queen Bee bid has put forth a monthly retainer type bid model, whereas they would seek to work with health department staff and create content for social media platforms, and then as well as some digital content. That includes some website content, photography, videography, some graphic design, printed materials, and essentially what was priced out within the bid is 16 hours a month at $75 an hour. This is Queen Bee. For management of social media platforms, meaning they would post content and then engage online. And then 10 hours a month at $100 an hour for the website development, photography, the creative deliverables. Essentially, on a per month basis, and obviously if the county were to need more, I'm sure they would add hours at the billable rate, so 75 for the social media hours and or $100 an hour for what they're calling agency hours for the creative content, but a base rate of $2,200 a month through potentially at the end of the year. And again, as Administrator Randy Partington stated, which is expected to be funded through the Spark CARES Act funding that you heard an update from Gary Meager and John Deardoff this morning. The second proposal that you had is from Bowercom. And in speaking with Lori Bauer and her development of this bid that you have in front of you, I think the differentiation between the Bowercom bid and the Queen Bee bid is there's more of a development of a concentrative communication plan in addition to the management and development of different aspects of that communication plan, in addition to message mapping, the strategy associated with the audience specifically tailored for the messaging that is seeking to be developed. And then after the initial development cost, which is sorry, there's not page numbers on these, but for the first page of the Bowercom bid, for $15,200 in the development of that market or the communication strategy. Then development of, again, she has deliverables here in terms of 5 posters, guidance sheets, initial social media graphics, banner ads, radio scripts, billboard artwork, and then a Reno County COVID-19 web presence in consultation and collaboration with health department staff. That all encapsulate that 15,200. And then she's also worked in a monthly retainer in terms of work in the management of said communications plan, which again is similar to the Queen Bee bid in retainer. So a minimum of the 5,340, which the strategies is broken out in detail in the bid. And then she extrapolates that out August through the remainder of the year to December. And she initially, I suggested October, but then potentially through the remainder of the year in line with the deadline for the expenditure of Sparks CARES Act money. Two aspects that I also think are something that plays into these bids as well is the regardless of the Queen Bee bid or the Bowercom bid, I would expect, and I'm not speaking for Randy, so if you have any comments, Randy, but there's been conversation administratively at the county about opening for the communications coordinator, or I'm not quite sure the title, but the communications position. And so, potentially with the Bowercom bid, there's an opportunity for an established communications plan that we could bring somebody on and they could potentially champion, which would then circumvent some of the monthly retainer that's placed out in the Bowercom bid. Or likewise, interfacing directly with Queen Bee as the point of contact, as the communication lead on behalf of the county, and then the development as such, and could potentially fluctuate. What I think if the Queen Bee bid is the bid that's pursued by the county, that if I remember reading correctly, I think the 2,200 is a minimum bid, so we would, for the duration of the agreement, which I can't remember the duration, I might just follow up. But anyway, that might be a minimum cost on a per monthly basis, depending on the timeline agreed upon, or it could simply be a retainer. I just need to seek clarification from Queen Bee on that. So those are some high-level run-throughs and just some thoughts that I've had around the bids, and then I would stand for any questions or comments that the board might have in regard to the bids in front of you.
Well, I'll preface my remarks by saying that I recall that I was one of the commissioners that suggested that this might have some potential for the county. So probably, at least my mention partly got you working on these two proposals. After seeing them, I'm becoming a little concerned that we're looking way too broad and too intensive. Nick did mention the fact that we are looking for a communications person within the county, and this does make sense that if we get something going here, maybe they could follow with it. But I'll have to say that I'm not as excited about the plan or plans, and I think either one would work, as I thought I would be. They're very, very oriented towards digital, social stuff, and I guess I'm one of the many people within the county that doesn't partake. And I think we have to remember that we do have a population within Reno County of older people. It's highly structured that way. We don't particularly want it to be that way, but that's what we are. Nick, I know you've done a lot of work on this, but I just don't know that we can do any more to tell people to wash their hands, wear a face mask, be a good citizen. I told Ron Hurst to be a good citizen, and he has been a good citizen with these masks. With these masks. I think we've had an enormous amount of the public understand how to be appropriate in this thing that we're facing. We're seeing national business daily say, don't come in our store without a mask because we think it's important. I was intrigued that I believe a National Health Club just went to that situation.
Planet Fitness.
And obviously that's not the easiest thing to do in a health club. I just really wonder deeply what more we can do to get people to conform to something that most of us think is positive. We're always going to have that group of people that said, we don't agree with you and science doesn't say this. I also understand that it's money being funneled to us that we're using, but I guess I would rather use it in some other way to create a better health department or emergency management district or something. So I'll stop there and listen to the other commissioners.
Well, Commissioner Summers, I'd like to jump in. I'm disappointed to hear what you're saying. And the reason why is because you're coming at this perspective from you, the social group, your friends, and what you see. The whole point of it is to get to the people that aren't like that, which are planning committees. That's why there's such a heavy influence on digital. That's why social media such a huge impact. You know, you say, well, I don't really see the need for that. Well, that's because you're not involved in that area all the time. And yet the majority of the people in our community are. There is a huge number of folks out there that still do not believe in masks, social distancing, all the hand washing, all of the stuff. Three of us may or may not believe it. And as the Board of Health, our responsibility, I believe, is to publicly push, acknowledge, support, and promote the best possible care for people in Reno County. And we need to find ways to reach the people that we're not reaching. I'm sorry, but you sitting there telling me that Applebee's is changing their hand washing policy. That's not what's happening. We're talking about getting people that haven't been convinced that haven't gotten a lot of information about masks. You may or may not believe it because you and I and Commissioner Hurst read the paper every day, go online every day, we talk to our friends every day, and every one of them looks a lot like I do. This program is written to impact the people that are not like us. That's the whole purpose of it. That's the entire purpose of it. The second piece is that staff, even though Nick continues to say, oh yeah, we can take care of it, we can do one more school report, I got to think that the health department staff probably gets pretty full of work. And I'm not sure that they're going to be able to do much more than they're already doing. I think we need to promote what's right to the people that are not getting the money. And I think this is the best way to do it. It is federally funded, so it doesn't cost any money. $20,000. Good foundation. New communications director to come in, pick it up, and run with it. I really hope you reconsider your position. And Ron, Commissioner Hurst, we haven't heard from you, of course, but Commissioner Sellers to reconsider your position. But Commissioner Hurst, I'd like to hear your thoughts.
Okay, Commissioner Bush, are you on voice, or we're at least I'm very struggling to understand some of your words. Could you maybe speak into the phone a little better? We need your help to understand some of your comments.
Okay, go ahead and ask me anything that you
Okay, it's better. It's better right now. You've done something different.
Okay, go ahead. I'm not going to repeat all of that.
No, I don't think that's necessary. I think I understand that.
I really do hope that we're looking at this differently than, well, I know this and my friends know this, so we don't need to say this.
I accept your point of view to an extent.
I understand the marketing standpoint. I am a lot like Commissioner Sellers in that we hear this every day. It's on television. It's all over the media with regards to what we as individuals can do to protect other people as well as ourselves. I'm not sure that, and I will disagree with Commissioner Sellers. I think the media, social media, is the majority of what at least the younger group uses, and even I do to some extent, although not near the extent that those that are quite a few years younger than I am. But I just I have a problem understanding what more can be done to actually make a difference. I think that the programs put together here with Next Contact with both the firms is excellent, but I'm not sure that I can quantify the difference that this would make, even though we're using OPM, other people's money, as well as ours that go into the state. And so I guess I need a little more influence regarding what this would do. I would rather look at us having a communications person working for the county. Nick, and if
I think Nick does make a good point, though, that some of the things that might be done by this contract might be a format, an organization for our person to take over and to
Yes.
do. It would certainly help our person to get going. I agree there very much.
If I may, I think the two comments, just based off the conversation to this point, I would agree, especially I think more so in the Bowercom proposal than the Queen Bee proposal, that again, we're not quite sure how long before we actually have an individual working within that communication scope on behalf of the county, but the potential of that individual to walk into a campaign and strategy from day one and be able to pick that up could be highly beneficial versus someone walking in and then there's a learning curve, not only to the employment on behalf of being employed by the county, but then also the strategizing around the health strategy and communication specifically. So that would certainly hyphenate that as we move into the fall and whatever timeline we onboard. The second, I think, is just generally one of the core principles of marketing from a business standpoint is repetition. And so, health department staff, myself, through many different modalities, whether it's in-person meetings, radio interviews, television interviews, or whatever the case may be, speaking to groups, hitting the same message. But at least for both, I envision, I will admit, outside of press releases that are administered and posted on the Reno County Emergency Management page and the Reno County page specifically, that is the extent of the social media presence on behalf of Reno County and its response to COVID-19. In conversations with both Queen Bee and Bowercom, but even more so robustly with Lori from Bowercom, is to fill that gap in between press releases being administered and actually engaging, interfacing, and trying to have that digital interaction just as much as I'm having those interactions in person. So if anything, I think it continues to hit that aspect of repetition of the similar message when Nick's not at the podium, so to speak. So.
Okay, I'm looking at the budget summary of the Bowercom proposal. I believe it's her last sheet, or second to last sheet. It's the one in green and yellow. The upfront cost of $15,200 is stated to be July, August. Well, July is done. Mm-hmm. If we were in agreement with this, would we push that back? Obviously, to me, you can't buy media, which includes in the monthly fee, until you have the initial thoughts done. So based on the fact that we're at the end of July, is it realistic to maybe do August for the 15.2 and September, October, November, December for the other?
I obviously I don't speak on behalf of Lori or Bowercom, but from my understanding of the bid put forth, that's certainly reasonable. I believe the 15.2 for the July-August timeframe was with an expectation that work on this was going to start in July, and obviously we have 1 week left in July. So I could certainly go back if it's the will of the board. I can go back, but I can't imagine that that's not feasible for her. Mm-hmm. So especially because the August through December are monthly retainers.
Will this take? I think the three commissioners, and if anybody disagrees with me, they can please speak for themselves. We realize how busy your health department has been through this. We understand how busy you've been and your associates in the health department has been. Do you see this taking some workload off your department? It seems like to me that most of this is new work. You're still going to have to do your daily
sit reps.
Yeah.
Your situation report. So most of this is new work.
Well,
do you see it any help to you to relieve the terrible workload that's on the health department?
I think I might shift your lens just a little bit, Mr. Chairman, in that I would again look at this as an investment in terms of, I don't know that it's going to take work off of my or staff's plate at onset, meaning we sign this contract and immediately we have something taken off our plate. But instead, my hope would be that the investment itself decreases work long term in terms of if we can mitigate and slow spread by a marketing campaign, much like if I refer in a business sense to I invest in marketing to hope to capture a greater market. I think that's more how I would frame this. Okay. Is hopefully the investment
I think that's well put.
Would help it.
Mm-hmm. Okay, is there any other discussion before we look for a motion?
I have a couple questions here on the
yes, sir.
Expense part of it, and then next to the last page. one of them is the travel and expenses.
Which agreement are you?
Oh, Bauer.
Bowercom, it's the second to last page, second bullet from
Travel
the
and
top. Yeah.
expenses. Seems like that is in addition to the 41,000. And
Uh,
what, you know, it's not spelled out exactly.
Sure.
In clarity enough with regards to how that will be used, and what, if any, there will be.
Sure.
I know it says shipping, general shipping, cost for airfare, ground transportation, lodging, meals, and general shipping will be estimated and billed separately. That's pretty general to me.
My expectation is that standard language that they put into their contracts. I know Lori herself is stationed out of McPherson, but they are a statewide, and I mean they do contracts all over the nation. So my guess is that's general language, but if the board wishes, I would have to assume, because we're geographically close, I would expect that probably mileage, shipping for deliverables in terms of posters, things of that nature, but and I'm just off the top of my head.
I don't see the problem you see there, Ron, concerned. I think that's a standard industry phrase that, and obviously we have to, he has to approve monthly invoices from them, so we'll see real quickly whether that's a factor, but I'm not concerned about that.
I just saw that, so I was
sure.
Being my tight person again, okay?
I personally feel that the Bowercom proposal is more intensive. It's certainly more money, but it's doing a lot more for the county. So my preference, if we're to do one, I think I would. Do you have a preference, Nick, in your recommendation?
As listed on the actual agenda cover page, staff preference would be for the Bowercom proposal. And again, I would echo what's already been said, is that I think the creation of a framework for a future communications person to lean into is really a strong part of that recommendation to the board this morning.
I think you make a very good point there. Very solid point that if a quality framework is given, that whoever we hire will start the ground running instead of starting at square one. Is there a motion here from either of the commissioners to approve the recommendation of the health director?
I'd make a motion to approve the Bowercom proposal as submitted by staff.
I'm sorry, discussion.
Okay, is there a second to that motion?
I'll second it for discussion.
Okay, there's a motion and a second. Is there further discussion?
If I may, commissioners, just based off of the conversation, I could reach back out to Lori Bauer of Bowercom to update the timeline that's placed here in terms of the conversation had around July, August, and have that updated, as well as I could seek further clarification quickly with regard to the travel expense line, Commissioner Hurst.
I think if this motion's approved, you could just update us via email or memo on what you find out.
Sure.
I think would be adequate.
Ask Commissioner Bush with regard to this motion with the understanding that that would be done.
I'm sorry, what's that?
The updating of the timeline.
Oh, yes. Well, I mean, staff is going to have, it's a living document as far as I'm concerned, and staff would have to update the dates and some of those things as well with them. And I'm sure if Nick had a question or a concern, he'd bring it back to the commission.
Okay. Okay, there's motion and a second. Is there any further discussion?
Commissioners, just in talking with Joe previously, he just would like to look at this if this is approved, kind of contingent upon him looking at the legal form. So when the numbers are changed, that Nick would run it by Joe just to make sure all the, all the document's completely ready. And that's just something
Okay.
that Nick could do without coming back to the
Sure.
commission, but just
I think that's
to put it on
understood.
record.
Yeah.
Okay.
Good comment.
That sounds fine to me.
Okay, I don't hear any more comment on this agenda item. Would the clerk please call the roll?
Commissioner Bush,
Yes.
Commissioner Hurst.
Reluctantly, I'm going to vote yes with my fellow commissioners because I think the framework, as Commissioner Sellers might be a huge difference here.
Certainly.
So yes.
Yes. Okay, thank you, Nick, for presenting that.
No problem.
Appreciate it.
Thank you.
Okay, our
Good day.
next item is to consider a petition pertaining to the vacation of a portion of Mohawk Road and Resolution 2020-22 pertaining to the same and setting dates.
Chair Sellers?
Yes.
Sellers, I apologize, but I'm probably going to have to get off now. I've had a couple of different staff people pop their head in to look for me.
Okay,
So I'm going to sign off if that's okay.
that'd be fine. Thank you for your time that you could give to us today.
Thanks and take care.
Yes, and I appreciate that. Thank you, gentlemen. I appreciate your kind words also. Thank you. Have a good day. Bye.
Okay, again, as I just read, and setting dates for road viewing and public hearing. Randy, are you gonna give this since Joe Sullivan is not here?
Yes. This is the beginning of the process to possibly vacate Mohawk Road. It doesn't actually determine that decision will be in August after the public or the road viewing, which would be, this resolution sets that for August 18th at 11 a.m. And that would be the 3 commissioners out there at the landfill on Mohawk Road. And then the public hearing would be August 25th for the decision. So adopting this resolution just sets sets this in motion to possibly vacate Mohawk Road. And I think you're all aware of, moving the scale house and how Mohawk Road in general would vacating it makes it much simpler for staff and the public when they come to the landfill. And Megan's here if there's any questions about that part of it, but the resolution really just starts the process to vacate Mohawk Road. The the easements, Joe has worked with Evergy and Ideatech, the 2 utility companies that have infrastructure in the Mohawk right-of-way, to give them right-of-way with Mohawk Road being vacated. So they still would be able to, they have to move their lines, but they would still have right-of-ways.
Okay, is there anybody in the audience, before we ask Megan to come up, is there anybody else that would like to speak to this issue?
RJ, would you come?
I wouldn't mind hearing Megan's input before I speak.
Okay. Megan, would you come and tell us why your department feels that this is in the best interest of the county?
Good morning, Megan Davidson, Reno County Landfill Director. Back in April, we started discussing this with the plans that we had, a new scale across the road and a customer convenience center. Currently, the way the plans are proposed, with this vacating Mohawk Road at our property line, going to the north on Mohawk to Clark and Mohawk of the intersection. The entrance of the new facilities is going to be right basically where Clark and Mohawk intersects. The intersection is currently. We are going to be borrowing material across the road on Mohawk on the east to the east side, where Reno County owns that property. So there'll be big equipment that'll be going back and forth across that road on a daily basis. Also, by closing, if that's what happens with Mohawk Road, just the flow of traffic coming in There's gonna be one way in and one way out of the landfill once this is constructed, as we are gonna have 2 scales, so everybody will weigh in and everybody will weigh out, coming in and out of the landfill. You know, we did have the options of option 1 and option 2. Cost-wise, you know, I have a cost for if we do have to realign Mohawk Road, which goes behind the facility, the new facilities. It's going to be in the realms of $92,000 to $100,000 compared to less than $10,000, maybe even $8,000 on just vacating a road with signage, making sure with township, you know, doing at the end where the property, if it is closed at that road, making it wide enough to where if they do maintain from the intersection to the south to our property line, they can turn around with their equipment, meaning the motor graders or any, you know, any other equipment they need to have on the end, with signage down there. So our thought process with this is mostly a safety issue for one. With those big scrapers going across the road, there's going to be a lot of traffic, and with it going one way in, one way out, there's going to be, right now you have a one way in, and you have 2 options to leave, you know, going by the scale house on the opposite side on the south, or you can use our exit only, which is Clark Road, which we did close off a few years ago. This is going to eliminate all that. I mean, the fence where it currently sits is going to basically, you take it and you move it to the east. So it's going to be a lot more, flow of traffic's going to be a lot different than what we've been used to.
What I've seen out there is a lot of obstructions with both 6th Street and Broadacres because of the length of trains that's coming through those 2 intersections, and the fact that we're not, and we used to see a maximum 1 mile train. Now we're seeing up to a 2 mile train, and some of those do some switching off of 6th Street. And I know they've been closed for well beyond the 20 minutes that we used to think was there. And so I just, has that been taken into effect that people now can't get in as convenient as they used to off of 6th and Broadacres? Instead, they may have to, they come in with Mohawk being closed there south of there, then you may see a lot more traffic either taking the 96 and getting off at 4th Street, going west, coming back in. You may see them coming in from Whiteside Road, coming in that mile. I think that's one of the biggest things I see is inconvenience that has come up since the original talk with the trains on UP.
Well, I personally can tell you, because I live west of the landfill. So 6th Street, there is a lot of those trains. Even on Broadacres, the train, you know, blocks 6th Street, blocks Broadacres. Of course, it's closed at the inner, you know, way down by Blanchard and Mohawk already. So a lot of times, you know, you have to go all the way to Whiteside anyways to get around. And honestly, you know, going in, it's a blacktop, Whiteside, if you take Whiteside to 4th Street.
Well, they won't go Whiteside. They'll take 50 Highway and take 96 and come in from that way rather than go all the way out to Whiteside if they're coming from Hutch.
If they're coming from Hutch.
So that was just a new
Right.
addition that's just come up here in the last month or so that I have seen.
Well, and I don't know, currently 4th Street's closed, because they're doing, the state's doing work,
Yeah.
you know, right now
Right.
for a while. So, you know, even at that, with 6th Street being closed, I mean, I haven't set out and looked to see how much traffic we've had in the last
that'll
week
be
or so.
fixed there. Those
Yep,
will
that
be
is only
fixed shortly.
temporary, so.
Hopefully shortly.
Yes, yes. And I've talked to a few others, even commercial haulers, you know, when this process, we started talking about it, and they had come to me and asked me, and their thoughts to me were they understood where we were coming from as far as operations wise. You know, we're not looking for, I mean, this is going to allow for 55 plus years here at the landfill. So, you know, it just is getting bigger as we go. I mean, even through this pandemic, we've been busier than we normally have. So traffic has been more.
Why have you been busier?
Well, when people were home, they were cleaning out their houses. They were cleaning out their sheds.
Okay.
They were, as far as the incoming traffic.
Okay.
So, I'm just looking at it from not only the safety standpoint of it, but just flow of traffic. Everything, change is difficult for everybody. And we're trying to make it to where, with it being a little different than we have it now, you're going to only have one way in and one way out of the landfill itself. Now, to get to the landfill, you'll have, technically Mohawk Road coming in from West 4th or East 4th. And then if you come from town, you'll also have, going through South Hutch options with all blacktop roads.
What's the present traffic count on Mohawk going south?
We have not had one done since, let me look, beginning of the year. And then when we did the traffic counts out there, the pipeline that was doing work that was at the racetrack to the north of the landfill, the first one they were back and forth because they own the ground just to the south of the landfill, the pipeline.
Yeah.
So they were doing a lot of work going back and forth, and a lot of that was that traffic. And then the second time we did a traffic count, they were finishing their project. Everything was done, so they were bringing in trash loads from the lines where they dug out, and they were bringing in material. The last time we did it, I believe, was, I want to say, right before it. We did the meeting in April. I've got it here.
I just know how many
March.
times I've had to go around.
It was March.
March?
Mm-hmm.
I just know how many times I've had to go around, go clear down, back down to 50 because both of those intersections have been closed. So that was concern I had that has just popped up.
Right.
I call it fairly recently.
And is that concern significant enough to make us pay the cost to reroute that road around the landfill?
I'm not sure yet. I'm certainly not sure yet.
Okay, so, are you wanting to study this further before
No.
we make a recommendation?
No, I'm not. I want to hear from the Reno Township.
And I will
Person
say
after
real
that.
quick, so our staff out at the landfill was going to do a lot of self-performing work to save the county a lot of money when it comes to construction of not only the road, or if we close it, or if we realign it, or the site construction pad itself. The new temporary road that's going to be, when we're doing construction, the road's going to be a little bit different to get into the landfill where it's at now, the way you come in. So, I mean, that's why it's important, whatever we decide to do to start this process now, and then whatever it ends up being, we would be the one that would help construct that realignment of the road around the new facilities, if that's what everybody deems that needs to happen. I mean, whether we close it or not. So, time frame wise, we're already in the month of almost August, and we're needing to get this project started very first part of next year, so.
I'd like the traffic count.
Okay. Do we do that now with 4th Street being closed?
No, I mean, we're
Just-
past traffic counts.
Okay.
We can probably come up with something that's useful out of that, or I think I can look at
We
it.
can get that. I mean,
And
I've
in
got the
conversations with you, I can look at it, okay?
Sounds good.
That sound
Okay.
all right?
Is there anybody else in the audience that would like to speak to this item, the agenda item? Sir, thank you for your patience today. You've been sitting here for an hour and 45 minutes waiting to speak.
And I'm old. It's about time to go to the bathroom.
Your name and address, please.
My name is R.J. Wenzel. I am the trustee of Reno Township as well as the road overseer. And I'll give you the township address, 601 Hendricks here in Hutch. First, I'd like to thank the commissioners for letting us have this time to talk. Second, I'd like to publicly apologize to Mr. Hurst. We had a misunderstanding, and we got that worked out. He has talked to me, and we are in communication. So, thank you, Ron. One of my concerns was mentioned by Megan that the previous board, when they closed Clark Road, they didn't put a cul-de-sac or a turnaround at the end. We are lucky enough that a farmer's entrance is there so we can turn our blade around, but short of that, it's very inconvenient. So I hope that is in your plans if the road does get closed. My other concern was the drainage that runs down that hill toward the landfill. Have they taken drainage into concern, how they're gonna work it around a cul-de-sac, where it's gonna go, how it's gonna work out? I know that's a big issue because it does run down the hill toward the landfill. I'd also like to mention that when the previous board was petitioned to close the other section of Mohawk, precedent has been set where One Oak paid $85,000 in compensation for closing that road for the inconvenience, and I asked the commission, what do you plan on paying in compensation for the inconvenience of the township, as we now have to go clear around miles of road to get to a little half-mile section, as opposed to if it was detoured around, we could still get through to Blanchard and the roads we maintain. I would like to say, as a township, we're opposed to closing the road completely. We'd like to see some way kept open for the convenience of getting around. And as Ron mentioned, for the traffic, finding different ways to get there when 6th Street and Blanchard and Broad Acres are closed with the train. It happens quite often.
Is there any way to find out how often this train activity occurs?
Just drive out there, I'm sure you'll get stopped.
There's 25 trains come through Hutchinson on that UP a day. How many stop? But it's a combination between those and the Santa Fe's switching into the propane plant right there at the old Coke plant. It's really a combination of those two. And I should explain a little bit, because I travel that road because our farm's right there at 6th and Broad Acres. So although I don't use Mohawk that much, we use the Blanchard going west when I have to go out there, but I don't go Mohawk that often, so
I'm also concerned on a short-term basis, if not long-term, that dead end being a trash dump. Oops, can't get to the dump, well, just throw it out here in the ditch. Is that you guys gonna pick it up, or does that fall back to us? Because right now, we pick up so much trash on Pennington Road. The dump's closed on a weekend. We make a Monday morning routine trash run, mattresses, chairs, brush, and I don't want this dead end to become the same type of situation.
We would take care of that.
You mean on Pennington, north of 4th?
Yes, it is just ridiculous. And on a side note, Randy and I haven't met you officially yet, but I would encourage you to reestablish your relationship with townships. We used to have meetings once a year with all townships. The county used to work with townships, and now, I mean, we even were wanting some dirt one time, and Landfill has lots of dirt, you know. We wanted to repatch the hole right at their asphalt. They wouldn't give us dirt for that. We had to haul dirt in, because they just aren't allowed to work with townships anymore. And I'd like to see that reestablished as a relationship all over. So, and that's my comments. Unless you have other questions for me, I hope the board looks at a lot of the situation, and that $90,000 may not be as bad as you think if you can keep it open, and it avoids a lot of issues. So, thank you.
Do you have an idea? I'm sure you know of the plan here. Do you have an idea how traffic could be, what we could do to maintain the safety should Mohawk Road be open and with all the heavy equipment crossing that? Do you have any suggestions in that
I really
area?
don't.
Should we do that?
I think you're okay with, like she said, you probably need to close that section so that it is a safety issue. But my concern would be is, why not go ahead and go around like the original plan was drawn up? So the Mohawk stays open, but it just turns and goes down Clark and then comes back around. Yeah, it's gonna be a little extra expense, but it solves your safety issue. It lets them go to work. And
It doesn't solve the same issue, because you still have big equipment crossing Mohawk when it's open. So that's why I was asking.
Well, I was under the impression the original plans was to come down Mohawk, turn onto Clark to about where your parking lot is at, and then they were gonna reroute Mohawk over and back and reconnect it at the closure. So the Mohawk would technically be open, it would just now be an L shape.
It's just, I think the original, maybe, Megan, let's hear it correctly, okay? Without me
So
trying to interpret it.
where our flare, that flare is just on the east side of the road, the gas collection flare on Mohawk Road.
Okay.
So where that flare is, just to the north, a little bit of that will be, would be a road where it would start and it would kind of dogleg off, and it would go behind the facilities that are going to be across the road, actually in that field that the county owns, and then it will be like an intersection. And I've got a map I can show on my files too. It's going to be a separate intersection from where Clark and Mohawk actually is intersected now. It is going to be a separate three-way stop, is what the original drawings was.
Well,
So
why don't you get together with RJ and that township so that they can show him that map of where it's gonna be. That way, I don't think it's clear that far east.
it's not.
Let's
It's
get
not-
together.
It's not as far east as where our parking lot is.
Okay, so
It'll
would you
be
like,
closer to-
Commissioner Hurst, are you suggesting we postpone this item?
No, I'm not. I think there's time enough to, for the township and Megan to get together and look at the map, and we
Before
proceed
we're
on
actually out there and
before
making
we're
that
actually out
decision.
there, yes.
And I will say the project itself, we already have drainage already addressed for drainage issues that I mean that's part of our stormwater plan. We've got everything, and I know what you're gonna say next. To the east of the landfill, where we have that field where it doesn't drain as well, it's got to get dry enough to where we can get down there and fix. We've already fixed it once, but we've got to fix it again.
You might look at the tube that goes underneath the parking area.
Mm-hmm. Yep, we're aware of that.
Okay. You're not going to solve the distraction from going out in the field just by trying to build it up a little bit, unless
Yeah.
there's a way
Nope.
to get it out.
We are aware of.
Excuse me, I'm getting too particular on this.
Well,
Commissioner Sellers.
No, I think, I think you're fine. So, as I understand it, you might be willing to make a motion to approve this resolution, which really says that we're gonna look at this on August 18th on the site to understand the issues and problems.
Yes, I think we've proceeded with this in a long-range plan that we need to continue with what we looked at. So I would move to consider the petition to pertain to the vacation of a portion of Mohawk Road in Resolution 2020-19 or 20?
22.
22? Okay. Pertaining to the same and setting dates for road viewing on August 18th at 11 a.m. and then a public hearing on August 25th by County Councilor Joseph O'Sullivan.
Okay, there's a motion, and I'll second that motion. Is there any further discussion?
Only thing I would add is it would have been nice to have been in the loop a lot sooner than now. And again, maybe that'll fall back to you, Randy, with working with townships, and if you're gonna close a township road, talk to them.
Mr. Wenzel, I would say that to your point is you can't have too much communication, and if we haven't been in communication with the township, I think we should have. Obviously, you can't go backwards. I've seen this in the paper more than once. Don't expect you to read the paper. But I think you make a good point that communication with the township should have been done before now. No more communication discussion. Please call the roll.
Yes.
Yes.
Thank you.
Thanks, Megan. Thanks,
Mr.
RJ.
Wenzel, for being here.
Well, there is, by the way, an official notice that does go to the township as part of this process once the viewing and the process is started. So
They'll have
They-
an opportunity to be at that location.
Oh, yes,
Yeah.
and at the public hearing. So, I
Sure.
mean, this is a month away.
Okay.
So,
Okay, thank you, Joe. Okay, next item is discussion of special districts budget overview by Randy Partington, County Administrator. Randy?
Okay. This is the 2021 budget summaries for the special districts. This includes the fire districts, sewer districts, and water districts that are in Reno County. And I have on the computer, if you want, I can pull up the spreadsheet. It's not much different than what you have in your packet. You can't control it from the podium. And then I can get into detail if you want to look at each district in detail. A quick overview of the districts. Our fire district, all fire districts went down in the mill levy. The recommended maximum mill levy had small decreases or flat, except fire district number 9. The bond and interest of that district, which is in the Haven area, has a small increase. Valuations, changes in valuation and cash balances impact all the mill levies for each of these districts. The Fire District 2, which is right around Hutch, the one adjacent to the city of Hutchinson, had a 10.32% increase in their valuation. So that helped quite a bit. The expenditures, the contract expected amount from the city of Hutchinson did have an increase for the 2021 budget. So their increase in valuation helps cover that increase in expenditures. The Nickerson Fire District had a valuation go up 1.79%. The Fire District 6 and 7 that are in western Reno County, both valuations went down. Their valuations went down over 6% in both those districts. And then Fire District 9 had a small increase. Fire District 8 also had about a 5% increase, or just under 5%. The sewer districts, kind of the same. The one in the Habit area had a valuation increase of over 12%, where a couple other districts had 3% increases. The one in the Cheney area had less than a 1% increase in valuation, so there's not a lot of value in that district. Water districts, the Highlands Water District went up about 3.5%, 3.4%. The Yoder area went up 6%, and that's in valuation, not in mill levy. The mill levies are very close to being flat. When we had discussions about each individual district budget, we looked at to try to keep the mill levies as flat or constant as possible, with the maximum amount of expenditures in each district without requiring a resolution. And so that's what shows the mill levy changes. For Fire District 2, it went down 1.4611, and part of that's because their valuation increased. District 3 was pretty much flat. It went down 0.001. Fire District 4 went down 0.012. District 6 went down 0.023. District 7, 0.036. Fire District 8, their general fund went down 0.042. The bond and interest fund went down 0.051. District 9 went down 0.017. Bond and interest went up 0.003. That was the only increase out of all the tax levy or the districts. Then the Fire District Joint number 1, general no change, bond and interest no levy. Fire District Joint 2 general went down 0.006, bond and interest down 0.427. And then the sewer districts, District 1, 0.715 decrease. District 3 and 10 general fund went down 0.077. The bond and interest does not have a levy. Sewer District 201 went down 0.240. Sewer District 202 went down 1.941, and that's one that had a valuation increase a good amount. And then Sewer District 8, bond and interest is down 0.003. The general has no levy. That's kind of a quick overview without getting into each district. I can pull up each districts to show their expenditures, which are consistent with previous year's expected expenditures. And now each of the districts also have a reserve fund. At the end of the year, if they have budget money left over, they can transfer into their special fund, and that's where they start building that up to when, on fire districts, for example, where they can buy equipment. The water and sewer districts, their reserve funds are not as healthy as the fire districts, what they have. So any changes in the sewer districts and sewer districts will take a lot of work, which I know down by Yoder and Habit, we do need to do some work. And I will be meeting with Don later this year to look at what needs to be done for those districts. So
Why are there no mill levies shown on the water districts?
User fees?
Fees?
They have user fees,
In other
yes.
words, they
cover it with their
cover
user
that
fees.
money with a user
Yes.
fee. Okay, even though there was a significant valuation increase in Fire District 2, the mill levy's gonna go up $500,000. About, correct? No.
Go down.
It actually is going down.
Going down.
Yes.
It's going down even though the expenditures are up 10%.
Right, and that part of that's cash balance and valuation increase. Help
Okay.
cover that.
Randy, is it, and we visited a little bit about this before, but is in regards to, is it 201 and 202 sewer district, that's the Yoder Habit area, is that correct?
Yes.
As we proceed with this, is there a time that we need to schedule some meetings or communication between these areas with regard to both the sewer plans, or sewer potential, and the expenses incurred, as well as with the water situation that could come about with any further expansion? I know Yoder is getting tight on water supply, and so I just wondered, is there a time that we need to start thinking about some communication with regards so that the people understand what's going on with regards to the future of both the water and the sewer?
Yes, we definitely need to get in communication with the residents out there. That probably this year, we probably should start having meetings. I think it's overdue, time's overdue, past of when we really need to start looking at the sewer district in particular on some changes and improvements.
I know their reserves are not, are very inefficient, are not there.
Right, and Don Britton, the Public Works Director, and myself have had discussions that we need to start meeting soon, very soon, to discuss this, because we don't have a lot of time left to start making changes. But you're right, we need to communicate with the residents in the area that are paying for the service. Going back to the overall budget for the special districts, if you were to approve this recommended budget, this sets the maximum amount and sets the public hearing for these special districts for August 11th at 9:30 a.m. And we would publish the summary in the newspaper to notify all residents of the budget. And then on August 11th, people could come and make during the public comment, or you can make changes in the budget to decrease. You would not be able to increase any district's budget.
And so the fire chiefs will have notification of this.
Yes.
And none of these fire chiefs have asked for more? Of course, they're really limited to that 5 and 7 mil levies.
There's really not a lot of room
Okay.
on expenditures to go up. So this was their maximum amount of expenditures with the mill levy.
Is there a motion to approve and post these budgets for a hearing at a later date?
Is that what your request is, Randy?
That's my recommendation is for you to adopt this budget as the maximum and set the public hearing for August 11th at 9:30 a.m.
Okay, I would so move.
I would second that. Is there any further discussion? Not, please call the roll.
Commissioner Hurst,
Yes.
Commissioner Summers,
Yes. Okay, next item is coronavirus relief fund discussion by Randy Partington. We've already done that.
That is what
Okay.
Gary and John were here
Sure,
for.
okay. Okay. County Administrator, do you have any items today to discuss?
Yes, I do. I also wanted to see if on the special meeting, I don't know, in communication with Leslie during the meeting, I sent her a text. Monday may be a little too soon for her to have a lot of numbers. Even if she's working on the weekends, that may be quick. What are your thoughts of maybe moving that to Wednesday or Tuesday after the other commission meeting, moving to a work session or the next day? Just to get, and I can check with Gary and John for their availability. I think John's gone all next week actually, but.
That's fine with me. Commissioner Sellers, do you have a
Well,
preference?
I'm fine. I think we just need to have that meeting as soon as possible.
Right, yeah, because we don't want to bombard you with all the information at one meeting, but I will check with Leslie and Gary to see if there's a time other than Monday afternoon, if they're not going to have information by then. And we received, Leslie and Brenda let me know that the sales tax receipts for the month of, well, in July, for the month of May, was $416,482 compared to $373,365 last year at that month. So we are, compared to year-to-date 2020 versus 2019, we're 100.8%. So we are right on schedule for last year's receipts. So,
And in our budget for this year, did we increase that any?
for the 2021 budget or
No,
the
the
2021 budget.
No, I'm sorry, the 2020 budget.
2020, all departments had made cuts. We made about $1 million worth of cuts, which will help the cash balance. Now the 2021 budget, which we won't see those sales tax figures for till next year, but we had a 20% decrease in expected revenues.
Right. No, my question was for 2020, the 2020 budget, did it expect sales tax to increase, decrease, stay the same?
When the budget was approved,
Adopted.
it was lower than the expected. We always underestimate the revenues. So
Okay.
if it stays on track, we'll have more than what the budget
Okay.
expected.
Okay. Okay, other items, Randy?
Yes, then I just wanted to mention that, for your information, we're working on the IT department, Information Services Department is looking at, for teleworking people, looking at a new system, a virtual private network, a different system that would be easier or better for our security and for the employees, or for the county, for having employees that work from home or remotely. It's Citrix, and it would have 100 licenses. This would be COVID-related expenses that we would put in the CARES Act request that will come before you during a work session. But I just want to give you a heads up, that would be $260,000. And that's would get us the hardware or the software and the agreement for 1 year, the license agreement. There would be ongoing costs in the future. We don't know the exact amount of that right now. We also are working on a fiber project that a portion of this would be in the CARES Act money. The fiber would connect from the courthouse to the Public Works building, again, so we could have some remote workers at the Public Works facility. It would also connect fiber to the landfill's new scale house when that's completed. And that's estimated costs a little over $600,000. We're looking at that as a portion of that being paid for with the CARES Act money if approved.
That'd
And
be good because we have extra space up there in the second floor of the Public Works, I believe.
There is, and there's for some
Office.
it'd be usable for some departments that may not have a lot of traffic with the public, but that could just work with an office or a computer. We're also working on the maintenance. The maintenance department has a storage unit that does not have air conditioning, still needs insulation. It'd be about $50,000, maybe a little less, to get that put in place. That would allow for storage of PPE with COVID-related supplies.
So they need climate control?
It does need to be climate controlled, according to Adam. So I just wanted to bring those to your attention, a few of the items that Reno County's working on. And if you had any concerns about us moving forward with getting cost estimates and putting those in the request.
Okay.
Okay, and then the other item I have is the health department has a grant opportunity of $155,354.76. It's a non-competing grant, so if the health department, if Nick sends that in by Friday, the application, the money's guaranteed. He just has to give categories of how he's going to spend the money. He sent me a spreadsheet yesterday that shows up that $155,000. 30% may be used for personal protective equipment, 40% for health department and emergency management related salary expenses, 20% for outbreak investigation, and 10% for education and other COVID prevention expenses. If you guys are okay with this,
Yes.
general consent, then I'll let Nick go ahead and send that in before Friday.
I'm in
Okay.
favor of that.
That's fine.
Those are the only items I have.
Okay, Commissioner Hurst, do you have items today or reports?
You know, I have one. And I think you were unduly punished for our exchange the other day between when I said I know you meant not just me, you meant general purposes. And so I want just to assure you that the public knows that we just have a conversation here, okay?
Okay. Are you referring to when you said, what if I don't wear a mask?
Yeah.
Okay.
Yeah, that was just a general statement,
I
and
don't
you
know
answered
that,
general
I don't
statement.
know that I
so,
was unduly punished. There was a
well,
couple
I consider
statements by people that said I was inappropriate, but I feel very strongly that if you're a good community member, you're going to try to keep us all healthy. And you agree?
Yeah.
Yeah, thank you. The only thing I would have today is, I guess I did not understand that the county and the health department had so much to do with these school districts. Maybe that's new. But Randy, would you please help Nick in this process that he's got to go through to approve or react to their plans?
Yeah,
I
Joe
just-
and I will work with.
Yeah, I
Nick.
talked to the superintendents. Actually, any potential order would that you have to sign the order, if there's gonna be an order, but it has to be done in collaboration with a local health officer, as the last one was. And I anticipate, having talked to the superintendents as they were leaving, that we would only be addressing very limited, if it's to be done, that the restriction we would have would likely pertain to such things as lifting the age of mandatory requirements for children to wear a mask. I think that's something that they're thinking about. So I don't see that the health officer will have to spend a lot of time and effort in this. Having talked to them, I'm going to get the information that where they differ from the governor's order, and we'll concentrate on those few issues. And so I think that's what will happen.
Okay. Thank you.
Did that answer your question? I hope.
I think so. Okay, anybody have anything else? Not, we'll adjourn the meeting. Thank you very much.